We treat everybody, whether it's from the youth athlete all the way to the weekend warrior, all the way to the senior, all the way from the amateur to the competitive athlete to the professional athlete. We take care of everybody. We are a comprehensive orthopedic and sports medicine specialty run practice. And, we take care of ligament injuries, cartilage injuries, sprains, strains, fractures, arthritis, and we go all the way from conservative management all the way up to the most technical, surgical, skilled treatment possible.
So, we have not only the ability to get x-rays, we have an MRI machine here, but we also have the musculoskeletal ultrasound technology, which is a non-invasive, non-painful, innovative way to get a better visualization of the soft tissue injuries that people will have. It's not to replace x-rays, it's not to replace the MRI, it's just an additional tool that we can use to evaluate particularly those soft tissue and muscle injuries that will not show up on the x-ray. And it gives us the opportunity to do an additional diagnostic, non-invasive diagnostic test to kind of help come up with the optimal treatment plan for that patient.
It's important that if I'm dealing with a 16-year-old that's playing football on the junior varsity, to us, getting him better is just as important, and just as important to do it rapidly as it is for the professional athletes we treat. It's just as important to him. We treat a lot of 70, 75-year-old, a lot of the tennis players in town that play at the state level that have won state championships. We treat a lot of those. And so for me, if you're 75 years old and you're playing tennis and you sprain your ankle, that is just as important to me to get you back as fast as possible as it would be to have a professional athlete. And so we sort of approach them the same.
Every time somebody comes in, you have to think about, well, what's the long-term goal and what can we do to facilitate that? And our goal is not to do an operation. It's not to see how much therapy we can do, but our goal is to get that patient back to the life that they want to lead.
You don't approach injuries by kind of sitting on them and seeing what happens. You approach them by actively attacking them and getting motion as fast as possible and putting them in the right condition to control the inflammation, which can be medicines and other things. I cringe at immobilizing something that I don't have to, because when you immobilize it, you weaken it, and it gets stiff, and it creates a harder time for you to have functionality.